Primary, secondary and tertiary health facilities are getting the required attention from the Yobe state government, while the new ones were constructed, like this multi-billion naira maternal child care health complex, Damaturu. This week on Impact Yobe, we speak with the State Commissioner for Health, Lawan Ghana, on the vision behind establishment of the hospital and other healthcare development issues in the pride of the Sahel. My name is Mark Otabo. Welcome to the program.
Officials of UNICEF have donated drugs to the Yobe state government for onward distribution to 10 local government areas of the states. The gesture is part of the strategic measures to reduce shortage of drugs at the grassroots level. The symbolic handing over of the drugs to the Executive Secretary of the Yobe State Primary Healthcare Board, Kundi Machina, took place in Damaturu, the state capital. Speaking after the symbolic presentation, Machina appreciated officials of the UNICEF for the intervention, urging them to consider the remaining 7 local government areas that are not included in the list.
On behalf of the Honorable Commissioner for Health, Dr. Mai Ghana, the management and staff of the Yobe State Primary Healthcare Board, to receive these commodities procured by UNICEF MENA project for the 10 MENA projects of implementing LGS in Yobe State. These are multi-million naira commodities that have been supplied to the state to help improve access to qualitative healthcare services in Yobe State, especially in the 10 MENA projects implementing LGS across the state. And today we have not only received these commodities from UNICEF health specialists, Dr. Ms. Okoli, but we have also handed over to the respective TVC directors of the concerned LGS with a charge to them to ensure equitable distribution and proper utilization of these commodities for the purpose intended, so that will improve the health indices of the people in Yobe State. So we must sincerely thank UNICEF MENA project for this laudable initiative and intervention to strengthen the health system of Yobe State.
The Yobe State government, in partnership with UNICEF, organized a 10-day capacity building on life-saving skills for healthcare workers. Speaking with Impact Yobe crew, the facilitator highlights some of the benefits of the training.
What we want to achieve at the end of the program, we want to reduce the maternal and newborn mortality rate in Yobe State and in the nation at large. So we want each of our participants to learn the skills on how to reduce this maternal and newborn deaths in Yobe by applying it into in their facility while they are carrying out their work. So they will learn how to do their antenatal care properly in an ideal way, to identify risk factors, and then to know that any woman that have risks or danger sign, they should refer immediately at the primary healthcare facility to the secondary facility. And at the same time, at the end of this program, I want each and every one of my participants to learn how to conduct normal delivery, to apply AMSEL, which is active management of third stage of labor, identify danger sign during labor and refer immediately. And labor and antenatal and labor and delivery does not stop there. They have to care for the woman during postpartum and identify the danger sign during postpartum care also. And then they should know that it does not terminate in postpartum care only. They have to provide family planning services to these women so that they will reduce this maternal and newborn mortality in Yobe State. Then it does not stop here. I want them to learn how to care for the newborn, know how to do essential care for every child that deliver normally, and to identify danger signs and resuscitate this baby and know how to refer immediately.
The participants, drawn from various local government areas of the state, appreciated the organizers for the training to upscale their skills.
A lot of things have been done, such as antenatal care, normal delivery by using the AMSTELs, the resuscitation of the newborn. In the antenatal care, we have learned how to identify problems from the pregnancy to the childbirth after the childbirth by postnatal period. By applying the AMSTELS, which is that active management of 12 states of labor, we can able to reduce hemorrhage, which is about 23% of maternal mortality in Nigeria.
To appreciate their efforts because they really did a very good job to us, most especially to those people that are down the rural area. They were not opportune to have these updates, but just because of the fact that the collaboration with UNICEF and Yobe State Primary Healthcare Board, they make an update that all of us we are benefiting from this. So we really want to appreciate them.
All right, you're welcome to this special interview segment, and today we're focusing on health. And I have with me the Chief Medical Director of the Yobe State Teaching Hospital, Dr. Baba Waruguni. Good to have you on the show.
Thank you very much.
Thank you for coming. All right, sir, can you just please give us a brief review of what actually necessitated the establishment of the Yobe State Teaching Hospital?
Well, going down memory lane, this hospital was conceived in the year 2007 by the then administration of the late governor, Senator Momon Ali of blessed memory, because of the need to establish tertiary healthcare center for the teeming population of the state. Now, civil work began in 2009 and it was completed in 2014, including equipment and other things. Right. And then subsequently, the management team were appointed in 2016 and we commenced clinical services in 2017. So we've been working for the past 7 years or so. However, if you look at, we've undergone through a protracted insurgency of over a decade. There was fleeing of health manpower from the state, and it was very difficult to attract people to come back to the state. And that necessitated a conversion of the hospital to a teaching hospital. We start on the tripod mandate of, a provision of tertiary healthcare services, training of health manpower at various cadres on various levels, as well as, research on prevailing health situations, challenges in the region or in the state, so to speak. So these are, briefly, that's what necessitated the establishment of this hospital.
Okay, I want to understand something. Now, the idea of having a 200-bed facility, was it conceived because you wanted to serve the whole northern eastern part of Nigeria?
That's right. Initially, it was a 250-bed facility, but with the coming of the Honorable Mai Mala Buni Administration, it has been upgraded now to almost 750-bed capacity. We have state-of-the-art, a very giant maternity and or maternal and pediatric complex, which was commissioned by our former president last year in February, which is about 400-bed capacity. And at the same time, also an isolation ward was constructed during the COVID pandemic as the state's contribution to the response to the pandemic, which is a 200-bed capacity isolation ward. We also have a 40-bed capacity accident and emergency that has been also recently constructed and equipped in the hospital. So if you look at everything put together, we're approaching around 800-bed capacity hospital. And at the same time, as far as training is concerned, with our sister institution, the Yobe State University, a College of Medical Science was established. The first set of clinical students are now almost 1 year in their clinical posting. We're expecting another batch in the next 1 month. Wow. So Yobe State will be producing its own indigenous trained doctors in the couple of years, 2 or 3 years to come, so to speak. And then there are other additional allied health sciences courses that are coming on board, like Bachelor of Nursing Sciences, Bachelor of Medical Laboratory Sciences, Bachelor of Medical Radiography. We have also commenced physiotherapy and so on and so forth. So the hospital has started realizing its objectives, the objectives of establishing the hospital. Also, together with the state government, more than 50 doctors have been sent for postgraduate training, as residency training to specialize in various fields, both within and without the country. So, and some of them have started returning back, but that will provide the health manpower as well as, you know, the critical mass of lecturers that you need, clinical lecturers as well as those in basic clinical sciences that will train this crop of medical students that will become doctors tomorrow. At the same time also there is a bio-RTC center, which is a research center established by an indigene of the state working at the University of Sussex in the UK, Professor Mahmoud Bukarmaina, who is with collaboration with this hospital also, we are going into various researches. For example, it may interest you and other viewers to know that Yobe State is one of the states with the highest burden of chronic kidney failure in the country, especially in communities along the fringes of the River Yobe in the northern parts of the state.
And I understand that your hospital offers free dialysis.
Free dialysis services, that's right. So we've been offering these services for the past 7 years. All indigents of the states who are suffering from chronic kidney failure, they come for free dialysis at these facilities. At the moment, we do about 600 free sessions of hemodialysis every month. Wow. At the same time also, we also offer other supportive services to these categories of patients. For example, for you to get access to the blood lines in the body, they need a simple operation on the arm called the AV fistula operation, which is in the region of 150 to 200,000, but is on free of charge for almost all these patients. Wow. Courtesy of these free dialysis services. At the same time, His Excellency the Governor, along with his delegation, which I was privileged to be among, we went to the United Kingdom last year in order to establish collaboration with research centers such as the Crick Institution in central London, the London School of Hygiene and Tropical Medicine, the York University, as well as the University of Sussex, in order to go into partnership to develop, in terms of research as well as staff and student exchange program for the medical school. So part of the research is also trying to look at both the remote as well as the immediate cause of this prevalent chronic kidney failure that is affecting populations in the northern part of the state. We've already collected preliminary data from dialysis units, especially here in Yobe State, in neighboring Borno State, as well as Jigawa State. We have already identified hotspots where we have such cases are coming from, and very soon we're going to do a population-based study in order to find out what is the cause of this problem, particularly trying to look at the water and the soil in those communities, as well as look at the blood of the people, because there may be some either heavy metals or other toxins, environmental toxins, that could be responsible for this prevalent kidney failure.
Well, the surface you've scratched so far, I can tell that medical tourism is already here.
Yeah, of course.
And can you just take us through a bit of some of the state of the modern art equipment?
Right. If we look at our radio diagnostic department, we have state-of-the-art equipment such as the 1.5 Tesla MRI machine, which is the only one that is functional, I can say, in the whole of the Northeast at the moment. And we have patients coming from all the states in the Northeast and even from outside the northeastern part of the country, as well as the neighboring Niger Republic, because we are sharing almost between 200 to 250 kilometers border with the Republic of Niger. And these communities, they share a lot of common cultures, as values and so on and so forth. Yeah. So people come in here to access healthcare here at this facility. We also have a 164 slides, CT scanning machine, digital X-rays, 4D and 3D ultrasound machine, mobile X-rays, C-arm X-rays, and so on. And then when you go to also the laboratory, we have fully automated machines, especially in the Department of Chemical Pathology, Hematology, Microbiology, as well as histopathology. We also have facilities for minimal access surgery, especially in the theater, such as laparoscopic surgery and so on and so forth. Also eye surgery. At the moment, we are almost leading the way as far as eye cataract surgery is concerned. People do come to these facilities on a weekly basis from neighboring states as well as neighboring countries to access affordable quality cataract surgery, because it's in the range of 7,000 to 15,000. So a lot of our people who have been, further impoverished by the ongoing insurgency and so on and so forth, they will be able to access this, affordable health care.
Mentioning all of these equipments and the facilities you have, the concern Nigerians will always have is maintenance. Because in most cases you have a lot of these, equipments, and it goes down the drain because the maintenance culture is very low in this part of the world. So what structure have you put in place?
Well, before we even procure this equipment, we've gone into, service level agreement, as well as hands-on training on the usage of this equipment with reputable companies or their representative here in Nigeria. For example, most of our equipment in radio diagnosis are supplied by JNCI, which is a very known company in Lagos, and they have their maintenance engineers all across the country in the various regions. And within 24 to 48 hours, if you run into trouble, you can get across to them, and I can assure you that somebody will be on ground to look at what is happening. We have a biomedical engineering and maintenance unit in the hospital, who usually they do day-to-day maintenance of this equipment. And then if we have any problem, we phone those suppliers and they do come to attend to us.
All right. Can you take us briefly through the journey, the maternal care aspect of the hospital?
You know that the northeastern part of this country has one of the dismal indices as far as maternal and prenatal or under 5 mortality and morbidity is concerned. And this entails the establishment of this 400-bed maternal and pediatric complex in this hospital, which has state-of-the-art equipment. Recently, we've gone through recruitment of health manpower. His Excellency Executive Governor of State, Honorable Mai Mala Buni CON, has approved the employment of more than 300 staff, that is including 25 consultants, as well as other cadres of medical doctors, nurses, midwives, perioperative nurses, and nurse anesthetists, and other support staff to man that complex. We also have a special care baby unit for the newborn, with health challenges that can be managed there, with state-of-the-art equipment such as phototherapy machine, incubators, baby cots, and what have you there. And it's also linked with the obstetrics theater, so that if the baby that is born has a problem, you can immediately move the baby to the special care baby unit under the same roof without any problem, so that they will start attending to such baby. We also have transport incubators. Even that stopgap, you'll be able to move them under care. At the same time, also the labor ward has almost about 30 delivery beds in which you can deliver about 30 women at a time. And then it's also linked with the obstetrics theater. If they have problem, you can move them in there. We also have about 18 consulting rooms for the antenatal clinic with an attached laboratory, gynae emergency, a satellite pharmacy, and what have you. Also in the pediatric wing, you have pediatric emergency, pediatric medical ward, pediatric surgical ward, and then postnatal antenatal clinic, as well as gynae clinic. You also have offices, seminar rooms, teaching areas for consultant nurses, postgraduate doctors, and what have you. So it's a full package. 1 megawatt solar powered panels there to complement both the national grid as well as the power generating plants that have been blackout and things like that. Security has been outsourced to a private outfit, so that you'll be able to offer quality service, because they can hire and fire. So if anybody is not complying with the standards, then he will be shown the way out. We also have CCTV cameras all around. It may also interest you to know that our hospital has migrated to what we call electronic medical record in the last 2 years. So we are almost paperless now, operating paperless. At the same time, if you look at the Department of Radio Diagnostic, also we have what we call the PAC system. That is picture archiving and computerized system, in which both X-ray pictures as well as images from either MRI or CT can be sent to various parts of the hospital without carrying films around and with the report and so on. And that has gone a long way in revolutionizing medical care. We are almost at the frontier of modern medical care now at the moment, and at the same time also it will help in saving a lot, because you don't need to print films and stuff like that.
All right.
Yeah.
Now you might have to dwell a bit on the vaccines, because vaccines have raised a lot of questions in the past past months from the COVID-19 era. There's been a lot of controversy around it.
Vaccine hesitancy.
Yes, the basic vaccines that the hospital actually offers.
Right. If you look at in terms of routine immunization, the state government, through the Primary Healthcare Management Board, that's the agency in charge of routine immunization, especially of under 5 children in the state. And our state has even gotten a national award as the most improved state as far as immunization routine is concerned. And we received that award about 2 years ago. And in the last 5 years also, we had received another award, which resulted in even some grants from the Bill and Melinda Gates Foundation, which has helped the state in improving health infrastructure across the state. So, and at the same time also, His Excellency has established a high-powered task force at the state level, headed by the Deputy Governor, as well as some of our first-class emirs, especially the Mai Bade, who is also an advocate of immunization for children and advocates for quality health care for his community as well as the state. And that has really helped for a community buy-in, as well as reducing the so-called vaccine hesitancy across the state, because community leaders, everybody who is a stakeholder is on that committee. And that has helped the states, in going through all the nooks and crannies of the state to make sure that our children are being vaccinated. I think when it comes to vaccination, Yobe State is doing a great job.
All right, I have a bit of concern with those residing in rural areas, because we understand that proximity also might actually deter a lot of them to come here to get the real treatment. Do you have plans for satellite, modern facilities that they can be accessible to?
Right. If you look at facilities in the rural areas, His Excellency, in his first tenure, he promised to establish one functional, primary healthcare center in each of the 178 wards across the state. At the moment, about 140 functional primary healthcare centers have been established. So academically, if you are to score him, you give him a distinction. That's almost 70% and above at the moment. So apart from that also, the road network in the state. Yobe is one of the states in which all the local government headquarters have access road networks, and that will help because accessibility is one of the fundamental principle as far as healthcare service delivery is concerned.
Before we round this off quickly, I know you want to go on and on, but you might have to touch on a bit with the free drug policy that has been
in existence. The free drug policies policy has been in existence for almost 2 decades now, so to speak, and His Excellency was able to sustain that free drug policy, in which all pregnant mothers as well as under 5 children will have access to free drugs, free delivery, including C-section, so cesarean section at point of delivery. Then at the same time, the Yobe State Contributory Health Management Agency has also helped, in which all civil servants in the states who are in the formal sector, both in the state service as well as those in the local government service, can now have access. At the point of health service delivery, you only spend 10% of the total cost of healthcare, whether in terms of drugs, whether in terms of surgical operations, whether in terms of laboratory investigation or what have you. So that has gone a long way. And mind you, all you need to contribute is 5% of your basic salary, minus allowances and so on. And out of this 5%, the state government is paying 3.25%. All that you need to pay is 1.25%. So, and Yobe is one of the states that is doing that presently at the moment. Then at the same time also, the non-formal sector has also now, is buying into this health insurance or the contributory health scheme. Because as an individual, you only need 12,000 to register and enjoy this package or service of health financing for 1 year. So at the same time, you can also register as associations. Also, philanthropists and politicians can also register people from their constituency. If you have people who are vulnerable and you think they need medical care, you can register them, and then they'll get free services. They only pay 10% at the point of care for the next 1 year, and just you need to renew it every year. At the same time also, through the Basic Healthcare Provision Fund, which is derived from the 1% consolidated revenue of the federal government, vulnerable people, more than 40,000 or 45,000 people have been registered under the Basic Healthcare Provision Fund. People who are vulnerable in the community will be able to access free healthcare. Under also there is what we call the equity fund also. The state government last year earmarked about 200 million naira to register vulnerable people. More than 36,000 people have been registered across the state in all the 178 wards. In terms of the formal sector, more than 400,000 civil servants, both at the state and the local government, are presently, and their families are enjoying this scheme. So it's a game changer. It has gone a long way in helping individuals, families, and communities in accessing health care.
Dr. Waba, thank you so much.
Thank you very much.
Thank you for coming on the show. We appreciate you.
Thank you.
All right.
That's the much we can take on this week's episode of the program. Don't forget to join us next week for a fresh edition of the program. My name is Marco Tabo. See you next week.